does the practice of human values help in the delivery of healthcare and improving one's own health?
Sairam, that's a beautiful question, and we have a lot of young adults. We had a discussion this afternoon. So they realized, yes, that's a very important thing. Why we have to do medical camp? That's what was the discussion today. The human values, obviously we have innate human values, but as Brother Suresh was talking about, we just completely dissolve in this hurry-burry. We go to the clinic, I have 30 patients. We just don't focus on the patient as such. Oh, this is a fever patient, give this medicine and send them away. So the main complaint from the patients, they come, the doctors not even spend 5 minutes with me. And most often the diagnosis is even missed because it's not because of the lack of knowledge, it's because of lack of humanism. So just to best serve our own patients, we need to have human values. And number two, without that human values, we are not happy at all. When we don't have that happiness within ourselves, we cannot share that happiness with our patients. So it is mutually beneficial. Sure, I hope I answered the question.
Also, how one's own health, I know daily health delivery.
Yes.
That in your talk, you can repeat that again.
So
How it helps in improving one's own health.
yes, definitely. Thank you, Uncle. So obviously it helps us. So healthcare burnout is a big thing nowadays. According to the statistics, the suicidal rate is very high among healthcare professionals. You may think that we have the best knowledge how to take care of ourselves, but obviously we don't. We have a lot of frustration and anger that affects our own health. That is a big impediment for our own health. I want to take my own example because I can speak only through my example, how I experience it. So when I go to the hospital, the children, they were singing like Sarvam Sai Mayam, Sai Mayam. So that is my mantra. I may not have time to sit and do prayer. So when in America, we just go to the patient's room. The patients don't come to see us. When I tap the door, I say, Swami, you are the doctor going to see the patient. So when I go there, I see Swami literally. Many times he has proven that I am there. So that instead of like I get drained with my energy, I get so much energy. I have the same energy what I go to the hospital at 8 o'clock. Even at 6:37, I have the same energy. And Brother Aravind's financial workshop also, he talked about like tamasic time, sattvic time. As a doctor, I cannot discriminate the timings, right? For me, everything is sattvic time because I see God in every time. So every time becomes a prayer. And I go for C-section. I say, Swami, you are being born. I'm excited. I'm coming at 2 a.m. in the morning. My nurses are, oh, Dr. Sankaran, why are you smiling and coming? No, I have to smile. There's a new energy coming to this world. We have to give that energy to the patient. And when I'm waiting for the baby to be born, I chant Gayatri Mantra. Swami, let this child be an instrument of love. Because the population I serve is a lot of homeless patients, and the children are born to moms who are on drugs and things like that. So my heart truly breaks when I see that. So I chant, at least let me do this one service. I don't know how the development is going to be. Science says the baby is going to be messed up, but I believe in my prayer. So let me do that service. So I don't know whether it helps my patients or not. It truly helps me because I'm constantly in the contemplative mode through my work. So that really helps me to be very healthy. And the Human Values Program, I have done this workshop at my workplace. There is a total shift in the attitude of our employees. So usually the patient, the staff, everyone comes in with the anger. They say, oh my God, I'm frustrated, I'm depressed. There's a lot of complaints. Then within 6 months, there is tremendous change in their attitude towards the patients. So the workplace has become a Prashanti for me. Every day when I go to work, I'm very happy. I'm going to Prashanti, I'm going to see Swami. So a lot of examples there, but due to the interest of time, I wanted to finish here. Thank you, Sairam.
Dr. Reddy, you want to add anything to it?
Summarized well. Main thing is it helps in the healthcare delivery as well as for our own health. For the doctors, you think Dr. Swami said doctors are the worst patients. That is true. Now I realize I have recently a cardiac surgeon. He cuts hearts left and right, but he had little cut. He had to have a needle. He was almost about to collapse. And another one was the brain surgeon. A friend, I don't want to tell his name. He said just they wanted to draw the blood from his vein. He says, "Oh, I'm getting dizzy." I said, "You cut brains left and right, open the skulls, drill the holes." So when somebody else, you can do that, but doctors themselves practicing that, but knowing these human values makes a big difference.